Hi, friends. This episode of the Cozy Lung Lounge is brought to you by Hoot Nanny Joy, where your health and wellness take center stage. At Hoot Nanny Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootnannyjoy.com to explore the programs and choose the one that fits your journey best. Hoot Nanny Joy, because your health deserves a little joy.
Hey everyone, and welcome back to another episode of the Cozy Lung Lounge. I'm here with Gina today.
Hi, Amy. Nice to see you. I'm Gina. We're missing Kelly yet one more time, but she'll be back with us the next episode. Looking forward to talking to you. What's today's topic?
We're going to be talking all about chronic bronchitis. So I know last episode we talked about bronchiectasis, which sounds pretty similar to bronchitis. So today we're going to delve into chronic bronchitis and kind of separate the two, make sure that everybody understands what the difference is. So Gina, if you want to start us off, what is chronic bronchitis?
Well, chronic bronchitis is a long-term inflammatory condition of the airways. Really, the defining factor is a productive cough more than or greater than or equal to 3 months out of the year for at least 2 years. So a whole season or more with your cough being productive. It flares up and it flares down, and it's part of the COPD spectrum, but it's often under-recognized, especially early in the disease.
Chronic bronchitis isn't just what we call like a smoker's cough. So this is actually, it's not just some cough maybe from smoking. It is this persistent cough that happens over a large span of time, like Gina said, those 2 years, and it is because of persistent airway inflammation.
We've talked a lot about inflammation in other episodes. You hear a lot about inflammatory conditions in today's world. That's no different inside your lungs. So bronchitis is an inflammation of the bronchi. So a bronchi, I imagine that I'll have Amy put up some graphics later on when she's doing her magic. But think about it as tubes. So your bronchi are the tubes of your airways. They have smooth lining inside it, and they can get really inflamed. So think about, just an angry, red, inflamed airway. And then to protect that airway, it's going to secrete mucus to try to get rid of some of that inflammation. And then you become more inflamed and you cough some more. The science term for that is it's your goblet cell and your submucosal gland. They get hypertrophic, which means they get swollen, and then your airways get narrowed. Then it gets really hard to breathe. There's a few causes for that. Generally, smoking is the biggest cause of that. But there's some other things. There's air pollution, some occupational exposures, and of course, recurrent respiratory infections. If your parents smoked, you might have had a lot of infections as a child, which can set you up for chronic bronchitis later in life.
And that's why, so many times when we're talking about COPD, when we're going through different questionnaires with people and talking with patients, we always ask about those occupational exposures and life exposures. So people may not even realize living on a farm, you're exposed to a lot of herbicides or pesticides. If you work or go get your nails done all the time, if you're in a nail salon, there's a lot of dust flying around from when they're doing everyone's nails. If you are a cleaning staff, if you're a janitor, or if you clean facilities and you're around a lot of chemicals, if you're a hairstylist, we ask all these questions and kind of get in depth with this because all of those different things can really impact your lungs over time. And that's the biggest thing we've been trying to spread awareness about recently. The one happy thing that I've seen is when I go to the nail salon more often than not now, all of the nail techs are wearing masks. And it makes me so happy to see them wearing masks and protecting those lungs, because it does do damage over time and can lead to something like this.
I've really started just in the last year or two asking about occupational history during a PFT history. I've always asked if you smoked, if you coughed, but you hear all kinds of things that people have been into over their lives. Textile factories, so many factories in my area. So it's really interesting to see that occupational history. Very, very important. Let's see. When you're smoking, you inhale that smoke, your airways start to get a little bit numb, if you want to say, and the little hairs of the mucociliary elevator, per se, in your lungs stops working. Your airways are supposed to go up and up and up so that it gets brushing all of the irritants out, but that gets really impaired when you smoke. And so you lose that mucociliary clearance, and it makes the mucus get stuck, makes your disease get more worse. And for lack of a better word.
And one thing, if you guys have gone back and listened to our episode on smoking a long time ago, we talked a little bit about how the cilia will almost become paralyzed. And if you are a current smoker and you've just been diagnosed with chronic bronchitis, I want to just kind of say, don't think that it's too late to stop smoking, because like we talked about in that episode, some of that is irreversible damage. You may end up with a chronic lung disease, but some of that ciliary clearance can improve, actually, because your cilia will stop being paralyzed. They'll start being able to move and repair themselves a little bit. So if you are a smoker, or if you are exposed to a lot of things and you get diagnosed with something like chronic bronchitis, don't think it's too late for you and just keep on smoking or keep on doing what you're doing. It's important to make those lifestyle changes, because yes, you have been diagnosed with a chronic lung condition, but there are some things that can be reversed a little bit to really improve your lung function and your quality of life.
It's almost like chronic bronchitis is kind of the entryway to lung disease and COPD, because people often associate this with the smoker's cough. You may have a smoker's cough, starting in your late 20s or 30s as a smoker, and you become accustomed to that morning cough. That morning cough is chronic bronchitis. And so it doesn't just come on suddenly. You have been developing over many years. And so really the warning signs: persistent cough with thick sputum. You may be wheezing, short of breath. Particularly in the winter, you'll get a lot of frequent infections, more winded and tired than you used to be. And then when you're looking at your fingers, they might be blue or cyanotic. You might get some clubbing of your fingers. That's kind of a later disease, but that kind of tells to some of your oxygenation going on in your small blood capillaries. So those are some warning signs to watch out for. Not just a smoker's cough, it's really important.
Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At Blue Zone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit bluezone.health and take the first step towards stronger lungs and a healthier future. Blue Zone Health. Breathe better, live better. Absolutely. And some of the recognition of those early symptoms, maybe just noticing that cough, noticing some of that congestion, can really help prevent the progression of the disease into a more serious airflow obstruction. So start to notice some of these warning signs. If that's something that you or somebody else notice, it's important to go ahead and get tested and catch it earlier on rather than letting it progress.
Well, to find out if you have chronic bronchitis, you're going to go to your doctor. We're going to do a history and physical, review all of your symptoms, listen to your lungs. definitely they're going to look for a lot of things that would fit that chronic bronchitis, particularly the mucus production. So before you go to your doctor, kind of keep a little symptom log for a couple of weeks or a couple of months to let them know what might be going on.
Absolutely. And then the next thing you're going to do once you go in, if you've gone through the history and the symptoms and they're suspecting some sort of obstructive lung disease, is they're going to do a pulmonary function test. So this is something that Gina loves to talk about, and I'm learning about right now. I'm studying to get certified to take these tests. So I've been learning quite a bit about this. But they'll do some pulmonary function tests on you. There's lots of different breathing maneuvers that you'll do, but you'll do that just to confirm the obstruction so that they can see the numbers and understand what's going on.
Now, don't let Amy fool you. She did a lot of work in pulmonary function testing when she was in college. That's just one of those things to go through. Chest x-rays might be there. There may be CAT scans, particularly if you're smoking. You're going to want to get a CAT scan for lung cancer and other sorts of things. They'll rule out all of those things at the same time. During your PFT, you might be getting oxygen saturation to see if you need any extra oxygen when you're walking or when you're resting.
Absolutely. And if oxygen is something else that you may need, there's lots of different tests to go into that as well, which I know we've had other episodes on that before. So I would go back and check some of those out so we're not delving too deep into that and bogging you guys down right now.
What episode are we on right now, Amy? 40
oh my gosh.
something?
I don't even know. We're on season 2.
Isn't that amazing?
We're all the way in April already, and we do about 3 a month. So we are just rolling out these episodes. So I hope you guys are enjoying it and it's been really helpful for you. But we've got lots of other episodes, especially in season 1, that go through different things like pulmonary function testing and trying to figure out how much oxygen that you need if you are hypoxic. So that's a really good thing to go back through and look, is to delve deeper into some of that stuff in some of our previous seasons.
Okay. A lot of times you're going to get a diagnosis of COPD before you get all of the tests. But a lot of it is symptom monitoring, and then they confirm their suspicions a lot of times later. When you have chronic bronchitis, what are you going to be doing to treat it? Number one, you need to quit smoking. That will help prevent further damage from happening. Every state has an Illinois tobacco quit line. I refer to people that all of the time. Free patches, lozenges, gum, tips, tricks, all kinds of things that they might do. So smoking cessation, number one. Don't make it scary. Just take it one day at a time for that.
And then the next thing is bronchodilators. I know we talk about these all the time, but you've got your short acting and your long acting that you can use. And that just helps open up the airways so that you can help with some of that airway clearance and alleviate some shortness of breath.
A lot of times in bronchitis, you'll hear it called asthmatic bronchitis. Well, that's just one of those crossovers where you've got a lot of the symptoms of bronchitis and you have the tightness of the asthma that's reversed with a bronchodilator. So you can have a lot of different conditions in one lung. Pulmonary rehabilitation, we're going to recommend that with almost every lung disease. Same for chronic bronchitis. Keeping yourself exercise, your lungs in good shape, helps to keep the mucus moving, helps to keep all of your muscles using oxygen in really good, efficient ways. So pulmonary rehab, absolutely. You can do it virtually. We've got a virtual pulmonary rehab with Blue Zone Health. There's in-person rehabs at many, many hospitals, hopefully one close to you at your local site.
Absolutely. And pulmonary rehab isn't just about the exercise piece. A lot of times they'll have a physician on hand who you can ask questions to, who you'll get to see multiple times a week. And that can be really helpful just to make a personal connection with this physician. You see them, you can ask them little questions and say, hey, this doesn't seem quite right. But then there's also respiratory therapists who are on staff who, again, you can become friends with and get to know really well. And they can kind of help you with that early management of the disease to help you really understand what your body's going through and what are the best things to help. So it's not just about the exercise. There's so much education and personal connection with healthcare professionals as a part of that. So it's a really, really important piece.
Amy, you missed the Right to Breathe presentation this week, and we had a really robust conversation about pulmonary rehab with all of the participants. They talked about some good experiences, a lot of bad experiences, and it really does vary from place to place on pulmonary rehab. And some place like Right to Breathe support groups is a great place to get some of that education. It's free. It's often led by healthcare professionals, and you can get some of your questions answered in a non-threatening environment. So just another way to get some pulmonary rehab before you're ready for pulmonary rehab.
Absolutely. And the other thing that we always talk about is vaccinations. So making sure that you're keeping your lungs protected, doing your flu and your pneumonia vaccines just to help keep your lungs safe, especially if you are living with chronic bronchitis. It's just important to help prevent some of those other things.
Now, chronic bronchitis has a lot of mucus. And I know in a past episode, we've talked about colors of mucus, but this is really important here. If you're getting an infection, you need to get it treated with an antibiotic. If your mucus is normally kind of a white to light pale color, that would be normal, no infection. If it starts to turn yellow, green, or something different than normal, it may have a different odor or a taste, you definitely want to get that checked out. You could take a sample to your doctor or just call in and ask the doctor what they'd like to do with that, particularly antibiotics. They may ask you to do a few other things as well.
Absolutely. And then, of course, the last thing is just in some of the advanced cases of chronic bronchitis, you may be on oxygen therapy. So that's another thing that can be really helpful. And if you get put on oxygen because you are hypoxic, make sure that you're wearing it. I know that it's not everybody's favorite thing and it can be really hard to adjust to. But if you feel better and your body is healthier because you have the oxygen you need, then it's absolutely worth it.
Absolutely. Boy, I have so many problems getting people to want to wear oxygen. They're happy to wear a pill. And then I get others that say, hey, I'll wear oxygen, but only if I have the little battery operated one. Well, they don't always match with what you need. So be open. Oxygen's easy to use, and it can really help your life if that's something that you need. Again, your heart and your brain need oxygen to live. So we want to make sure you have plenty of that. That may not be for all chronic bronchitis patients. Again, that's usually a later stage. It may be that chronic bronchitis, you're really breathless because your lung function is bad. But since you don't have much emphysema in there, your oxygen saturation may be quite good. And so you may feel like you don't have enough oxygen, but you really do. And so that's one of those hard things to work through with chronic bronchitis. So you may want to work with a health coach or one of your office providers to work through some of those reasons for your shortness of breath.
Well, and the last thing I'll say on our treatment side is hydration, 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 because we are talking all about mucus. And with mucus, if it's not thin, it's hard to get out. So the more you can stay hydrated, the thinner we can keep that mucus, the better you're going to be able to clear it, the more likely you are to prevent infections from forming. Hydration is key for chronic bronchitis.
Boy, with most of our diseases, we want to prevent problems from happening. If we have beautiful, normal lungs, anything we can do to prevent them from being destroyed, the better. Once we have problems, we're going to deal with them as they come. So chronic bronchitis, we're going to do the best we can to take care of them, managing our symptoms, doing our lifestyle changes with our anti-inflammatory foods and lots of good exercise and hydration. And that can really slow the disease progression, improve the quality of life. If you don't believe me, go back to some of our old episodes with some of our patients who have told us about the power of how eating and exercise has really helped their chronic bronchitis. It really teaches us the power of prevention.
Absolutely. Well, again, hopefully, guys, this gave you a good summary of chronic bronchitis and gave you a little bit more insight as to what it is, the different diagnostic techniques and the different treatment options. So I hope you guys enjoyed this episode, and we will see you guys in the next episode.
Bye, guys. If you haven't heard the episode that you wish yet, just leave us a note and we will record that ASAP. See you later.
Bye, everyone.
Hi, I'm Kelly, a registered respiratory therapist with Blue Zone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better.